Well, welcome everyone, and thanks for being here with us today to engage with Oregon AHEC and with Pathway students as a workforce strategy. We really appreciate your time. We do have several speakers today who are here from across our statewide AHEC network. So we're going to take just a quick moment to introduce ourselves. I'm Mellison Zumwalt. I'm the program manager with Oregon AHEC. And I think I saw Eric's here. Are you here, Eric?
I am. Yes, Eric Weiser. I am an associate professor of family medicine at OHSU, as well as the Oregon AHEC director at the program office.
And Meredith, would you mind going next?
Sure. Hi, everyone. I'm Meredith Layer, and I'm the director of Northeast Oregon Area Health Education Center in LaGrande, though today I'm having the best time at the EOCCO Summit in Pendleton.
And Carissa?
My name is Carissa Scariano, and I am the administrative coordinator at Northeast Oregon AHEC with Meredith.
And I'm Nicole Bales. I'm the administrative coordinator for the Oregon AHEC program office. And I'm just going to switch screens here. This is our agenda for today's presentation and discussion. And I'm going to hand it over back to Eric to just kind of kick it off with an introduction.
Welcome everybody. This is just an introduction to how the AHEC works. So AHEC was really started in 1971 by the Fed, by Congress, as a result of reports that we needed to strengthen the healthcare workforce in rural underserved areas. The initial year, the idea was to start off with 12 AHECs, and I think they really surpassed that. Oregon was established in 1990, and it both got state funds to explore what an AHEC is and kind of set up that first federal grant. And then we got our first federal grant in 1991. How this is done is that it's part of the granting process. It requires at least a 1-to-1 match. In Oregon, that 1-to-1 match is provided by state funds. About 29 out of the 48 AHECs are funded, matched by state. Some aren't. And it is, we do have a line in the congressional budget. So our budget for the federal portion is decided by Congress through appropriations. And then those grant funds are administered through HRSA. HRSA is the Health Resource and Services Administration, and that's inside the office of HHS, the Health and Human Services. Overall, when you look at the network of AHECs, is not every state has an AHEC. There's a couple that don't, like Delaware, Iowa, Minnesota, Wyoming. There's a couple states that come to mind that don't have an AHEC. And some AHECs have more than one, or some states have more than one AHEC, like Texas and Florida. It's really designed to be a hub and spoke model, with the program office being at an academic center. A couple states that don't have a medical school, there's an exception that it can be at the state's nursing school, like Alaska. And then it's our spokes. We have 5 regional hubs that are across the state that hopefully cover the entire state to the best that we can with those 5 spokes. And that our funding from the federal office is determined by how many regional centers you have. So when we look at the total funds that gets appropriated by Congress, it's then divided among regional centers, and that's how we're funded. So as you see, this is our statewide AHEC map. At the 12 o'clock position there, it really highlights the program office here at OHSU, and all those QR codes are active. So if you want to know more about a region that you're in, or a neighboring region, when you get these slides, just point your phone to those QR codes and I'll take them to their websites. So in purple there at OHSU, that's me and our program office staff. And then going clockwise, we have the Oregon Healthcare Workforce Institute. That is our newest regional center. You can see that that's really kind of Portland Metro and Metro West, serving Clackamas, Multnomah, and Washington counties. And that's hosted by Pacific University. And when we say hosted, we mean that those folks like the regional center director and regional center staff, they're actually employees of Pacific University. When AHEC started, in the 90s, really most of the regional centers were independent nonprofits. And with the both budgetary crunch, because we've been mostly level funded since the 90s, and also just the fact of doing business now is a little bit more expensive when it comes to benefits and health insurances and things like that. There's been a nationwide trend to move from independent nonprofits to hosted sites. And so that's our most nearest one, started in 2017, hosted now at Pacific. Northeast Oregon AHEC is that mustard color, and that is that was our first center. That is our last independent nonprofit, and it's located in La Grande on Eastern University's campus. Cascades East is hosted by St. Charles. That one's located in Bend. That's that burnt orange or burnt red color, burnt sienna maybe. That might be better. Our next one is AHEC of the Southwest Oregon. That was our last one to go from nonprofit to hosted status, and that's hosted by the Viva Health Network down in Roseburg. It's a FQHC network. And then the last one there at like 10 o'clock, that's the Oregon Pacific AHEC. That one's located in Lebanon, and that's hosted by Samaritan.
Hi, everyone. Thank you, Eric. So I'd like to start talking about our local EMS services. Every year since we started doing MedQuest, our Health Career Exploration Summer Camp for high school students over 30 years ago, we have partnered with local fire departments and emergency services in La Grande and Island City. We bring the students to one or both of the stations during camp, and they rotate through activities with both paid staff and volunteer EMTs. This year, those activities included loading a student onto a stretcher and carrying them through an obstacle course that included a narrow and twisty flight of stairs. They learned how to intubate a person and how to insert an IV using a mannequin and this bubble wrap type packaging. They put neck and leg braces on each other. They played Jenga with the jaws of life. And they did this communication activity where one student had a map and they had to describe the map through a walkie-talkie to another student who had to draw it. After all those rotations, they did a Q&A with the folks at the station, including the new fire chief, and they all had a big barbecue dinner together. And all of this happened on the first night of camp. There's a couple of things I want to unpack here. Because this was held on day one, these activities served as team building icebreakers for the students, and it was highly successful. Our pathway program coordinator has been to quite a few camps in different capacities, and he said that in his experience, it usually takes about 4 days for the campers to really warm up to each other. But this year, they were friends on day one, and he really attributes that to starting out the camp with the fire department this year. Additionally, these activities really throw students into the deep end of healthcare, emergency services. Each of these activities showcases a specific part of the work that they do, and it's a really good combination of being directly and indirectly tied to healthcare. Things like the obstacle course and Jenga are fun for just about every student, no matter what their reason was for coming to camp. And it gave them all a chance to learn something difficult. That's what the students said was the best part. They loved having a safe place to make mistakes, and it really set them up well for the rest of the week. The crazy part about all this, my favorite part, is that we don't tell the fire department what to do. All we did was ask for hands-on activities and for them to talk to the campers about their careers. They plan the rest. They're even working on making a standard operating procedure book to plan camp each year. They're so excited. They already asked when we're going to meet next. We're going to meet in the spring, I guess, months before camp. They just really want to make sure that it's a valuable experience for students year after year, and they plan on doing it forever. It's just part of working for emergency services. They're not our only partner like this. The Grand Run Hospital here in town is so important to our programming that I honestly can't imagine what Neo AHEC would look like without them. This year, they provided 128 unique job shadows in just 2 days. A lot of those were one-on-one. This requires commitment and buy-in from every single department, which is just amazing to think about. They really create our programming as much as we do. The other regional centers are in the same boat as us. Cascades East and Bend is not just hosted by St. Charles. They have a job shadow program that brings high school students to the hospital to do job shadowing throughout the whole year. AHEC Southwest out of Roseburg partners with federally qualified health centers to provide employment to students in a gap year in between graduate and undergraduate level programs. It's just what we do. It's really the only way that we can offer these amazing programs. And these partners, they're really not just names on our site. They're local experts that bring real life experiences to the students. Even though our staff now has someone who can teach a few things, the heart of our programming really does come from the rural providers themselves. And all of this builds to a stronger health career pathway. The small town running into everyone at the grocery store isn't just part of our personal lives, it touches every part of living rurally. When local students stay in their hometown, they often return to work alongside their peers and the mentors that they grew up with. And our providers love job shadowing and talking about their careers because knowledge sharing is a part of who they are. The expertise is already here. All we do is open doors so that students can access it. And next slide, please. And it's not just the providers who sustain this work. Our regional center is supported by foundations, schools, other community partners who generously contribute through grants and in-kind donations like provider time and meeting space, and through other types of volunteer hours. Year after year, they keep investing, and their commitment reinforces the idea that the pathway doesn't stop at graduation. Students become professionals, professionals become mentors, the cycle just feeds back into itself. Alongside local support, statewide partners like the Oregon Health Authority also elevates our mission. In 2024, the OHA highlighted our summer camps and its strategy paper on workforce development and retention as a key pathway effort and recommended expansion. Thanks to subsequent OHA funding, AHEC centers across Oregon were able to offer free summer camps this year, removing financial barriers and widening access for students everywhere. Additionally, Oregon AHEC and the regional centers collaborate throughout the year with monthly director meetings and monthly coordinator meetings, which really strengthens our network through shared lessons and successes. So what I really want you all to walk away with is this. AHEC was built by communities and led by communities, it's sustained by communities. Without the heart and passion of partners like our local emergency services, Oregon AHEC would just be 20 people sprinkled throughout the state. Instead, because of the shared commitment, our network is magnified into something far bigger, a pathway where the wisdom of local professionals flows directly into the lives of future healthcare workers right in the community where they all grew up. That knowledge, that generosity, it is the health career pathway. It's irreplaceable, and it's the reason why we thrive. And I will pass the floor to my executive director, Meredith Lair. Thank you.
Thank you so much for the warm handoff, Carissa. You did amazing. I'd just like to ask everyone to think for a moment about the number of health professionals, ancillary services employees, or support staff that you might need to hire in your own facility. I imagine there are numerous positions open. I don't have to tell you that the U.S. is facing significant shortages in healthcare professionals. And that is why the continued investment in AHEC and our Grow Our Own Healthcare Providers mission and that aligns so well with our health career pathway programs have such a stronghold in our state. But there isn't a secret sauce that's going to remove the need for healthcare workers overnight. But strong, consistent approaches like AHEC has taken and really enforced over time can make a difference. I can cite numerous health facilities in my own region and throughout the state who have been positively impacted by our work and the work that they contribute to with lower than average rates of vacant positions. Pathway programs are critical to having healthcare workforce that represents our communities in Oregon. Pathway programs ensure that we have a stable, diverse workforce that looks like Oregon and our regions. And ultimately, that helps improve patient outcomes because it builds trust, because the workforce is really rooted in the community and understands the community. Inspiring students early on generates the spark and belief that there is an opportunity for them to make a difference in healthcare. They don't have to be what we would think about almost always as a doctor or nurse. There are so many positions in healthcare. So I'd like to read just a short quote from one of our campers. This camp gave me the confidence I needed. There really aren't any medical professionals in my family, with only a few exceptions, and I wasn't confident that my interests match what I was meant to do. After MedQuest Camp, I realized that there is a place for everyone in healthcare, and I am definitely pursuing a career that is right for me. MedQuest was an amazing opportunity that I'm thankful that I got to be a part of. I'm thankful for everyone at this camp. I got to learn so much. I'm definitely going to be researching more schooling options, looking into scholarship opportunities, but most importantly, I want to keep job shadowing at the hospital and potentially local clinics to get more experience. Pathway programs do more than meets the eye. Carissa already highlighted on so many of those things, but they build a community of people with a shared goal. And this provides them with unique hands-on experiences, long-term mentorship, and it doesn't stop there. The pathway at AHEC really doesn't end. As the students who were mentored return to the community to mentor, in my 25 years in healthcare and health career education, I've had the privilege of seeing this happen many times within NEO-AHEC and our local facilities. And it's not always us that stay connected to the students. It's the students that they meet at camp, the person that they job shadowed with, or others that they came into contact with. We are really just the conduit for them. Next slide, please, Nicole. But ultimately, I feel like I may have just spent a few minutes telling you something that you already know. Pathway programs are part of the panacea for healthcare workforce shortages, and we're not the only one who knows it. Sometimes it feels as though it's hard to keep up with all of the investments being made into pathways, whether by the State Department of Education, the state's workforce programs, private foundations, and others. Not one of these investments is better than the other. In fact, if we want to have the largest chance of success, we have to work together. One investment that you may have heard about is Career and Technical Education, or CTE, in public schools. There are many examples of successful implementation of CTE throughout the state and in my region. However, most of these examples don't include CTE in health careers. And there are reasons for this, including location. Very small schools don't have the capacity or resources required to add a certified CTE program. And teachers, most science teachers, and I'm married to one, they're not experts in health careers. So CTE is designed to provide career-connected learning, job shadows, and connections to statewide clubs. It is tied to a specific school district and has specific requirements for recognition at graduation. By contrast, AHEC is not tied to a specific school district, and it strives to meet students where they are. AHEC pathway programs also extend past high school graduation, assuring that students have support to achieve additional training and education and enter into the workforce. CTE and AHEC can work together to extend immersive career opportunities for students. For example, the CTE teacher at our local high school actively promotes our MedQuest camp to her students in her biomedical pathway class. Many of her students participate in MedQuest and deeply engage. After that, they often pursue a CNA license, more job shadowing, ask us for letters of reference, and more. These two programs work together to develop a stronger, better resourced, and more passionate future healthcare workforce. The resources together bring students from rural and underserved backgrounds up to the level of urban students. Next slide, please. So let's transition now to AHEC impact and success stories. As we've mentioned throughout the presentation so far, AHEC has been in existence for over 3 decades. That's a pretty long time, so it's safe to assume that we have some stories to tell. I'd love for you to visit our website and look for the stories of impact. I think Carissa might pop that in the chat. And you could read about some of the stories of impact that we found at NEO-AHEC. These stories and anecdotes, they really affirm the value of AHEC and provide no question that we hold a valuable place in healthcare workforce programming. But we've struggled the same way you all probably have on this call and all of those who aren't on this call today. We have to longitudinally track our participants to show quantitative results of our work. That's really hard to do because we start interactions as early as middle school. So with over 12,000 participants just in NEO-AHEC programming, I wish I could tell you more about them. I wish I could look them up in a database and connect them with current students who need a mentor. I wish I could tell our local health system just how many of their employees participated in MedQuest. I wish I could communicate on numbers, return on investment, to better advocate for funding, and the wish list goes on. And to some extent, I can say that I would love to be able to move the needle on disseminating the value of AHEC outward. And this isn't just a sob story or me quoting maybe a Pearl Jam song, but about 3 years ago, NEO-AHEC began the development of a pathway to practice data system using Salesforce. And we're getting closer to be able to do all of the things that I just wished for. Not only do we have our historic data in the system, which is about 2.5 decades, we're collecting new data in the system that's compliant with standards across our state. The system is unique in that the participant has a portal where individuals can set up an account, update their information, and register for events. As soon as we're able, we'll begin the daunting task of asking previous participants to update their own profiles, match participants to licensure databases, and build out the longitudinal part of our system. We're very excited about this project as a statewide AHEC system and look forward to a future that allows us to lead the conversation on appropriate investments in workforce and pathway programs. And now I'd love to turn it over to Nicole to talk more about stories of success and the impact of our work.
Muted. Thanks, Meredith. So as Carissa had spoke to, we're really thankful to the Oregon Health Authority, whose support has allowed us to expand our summer camps this year. Across our 5 regional centers and program office, we served 265 summer campers this year. That's a 26% increase from 2024. We were also able to offer all students scholarships to attend for free, thanks to the Health Authority grant, which eliminated financial barriers and opened doors for more students to explore those health careers. And the impact was clear. 97% of participants reported an increased interest in health careers in our post-camp surveys. And I think, it's also important to note, Carissa, I think, spoke to this as well a little bit, is that Oregon AHEC's pathway programming continues to be recognized in the Oregon Healthcare Workforce Needs Assessment as a critical statewide resource that strengthens educational and career pathways into healthcare. And, as Eric, Carissa, and Meredith all spoke to, AHEC has been part of Oregon's healthcare landscape for decades. And these are just a few stories that we think speak to the impact. This is Emily. Starting in high school, she really wanted to become a physician associate, but found the path to be daunting. She said AHEC provided the guidance, opportunities, and support. Sorry, I got distracted by a question. I finally realized where I could see where the comments were popping up. Sorry about that. But she said that AHEC provided that guidance, support that she needed to succeed. And then, I think most importantly, helped her believe that there was a place for her in healthcare. So from participating in AHEC Southwest pathway programming in high school to their Reconnect fellowship program post-grad, and later joining the AHEC Scholars Program during PA school. AHEC played a crucial role in shaping her career. And she's now a practicing PA at a urban underserved FQHC. And then Janet's passion for healthcare also started in high school when she participated in AHEC's pathway. She credits her success in becoming a nurse to MEP and Oregon Pacific AHEC, and she now serves on the center's board to support the next generation of healthcare workers. And Lauren was inspired to pursue a health career in middle school after she participated in Northeast Oregon AHEC's Girls in Science program, which is now known as Investigators in Science. And during PA school at OHSU, she reconnected with AHEC through the AHEC Scholars Program. And after graduating this summer, she's returning to Eastern Oregon, where she grew up, to practice at Winding Waters Medical Clinic and Enterprise. And so these are just some of the stories, but like Meredith said, you can find more on our website, on the program office, or on NEO-AHEC's website. They have a really wonderful bank of stories. And I'll hand it off to Millicent.
Great. So now we're going to look forward just a little bit. You've heard some about Oregon AHEC. You've heard some of our impact and success. And as we look forward, I am happy to say that as of last week, we have received our full allotment of level funding for this year. Our program year started on September 1st, goes through August 2026. For those of you who might also be participating in federal organizations or with federal grants, you know that this is very exciting news for us. We're very happy. And we are also cautiously optimistic for the same level of funding for our program year in 2026-27. So great news. But as we all know, level funding for multiple years, which it's been getting close to about 5 years now, is in practice a funding cut as expenses continue to rise. So with that in mind, we do continue to actively seek additional funding opportunities, largely through grant opportunities. You heard Nicole mention the Oregon Health Authority grant that we were very excited about this year. We also look at other state opportunities, local and private foundations, CCOs. So if any of you are connected to organizations where you feel you might have a funding opportunity where we might be a competitive applicant, feel free to reach out. Let us know about what opportunities might be out there that maybe we haven't thought of or we might have missed. Next slide, please. But the message is we are here, we are funded, we are a healthy, long-standing organization. We're passionate about our work. And a big takeaway I hope that you're getting from this presentation so far is that our pathway programming is only effective because of our amazing volunteers. We rely very heavily on our communities, on our partners, on our one-time volunteers. So we need healthcare students and professionals to serve as career speakers, as mentors, to lead interactive sessions, to provide job shadows, clinic tours, give input into curriculum design, serve as advisory board members. There's many, many ways to partner with and get involved with Oregon AHEC, and we are excited about your interest and involvement with us. And we really want to encourage you to reach out to your regional center. That's why we have this map here. Our regional centers cover every corner of the state. So no matter where you're calling in from today, there is a regional center that serves your community, and they would love to hear from you. I want to add that, yes, can we stay on the map, please? One more minute with the map. I want to add that yes, our pathway programming is designed to serve middle, high school, undergraduate students, but engaging as a volunteer with our programs also serves health professionals. We do work very hard to ensure that our volunteers have a meaningful experience as well, and that we're also serving you. I thought Carissa's example at the beginning of the fire department being so excited about the next year's curriculum is a wonderful example of that. So you give back and you get something from it as well. And I'd like to end with a quote of my own that I pulled out. This is from one of our summer camp volunteers. This was an investigator who presented to our campers and led them in a hands-on research activity. And she said, "I just wanted to drop a quick thank you note. I was able to make 2 connections yesterday that were really impactful. One gal was from Medford and the other was from Kaiser, and the conversations that we had about cancer, research, and reaching for your dreams really touched me. And I've been thinking about those 2 students since we parted ways. I know they were the mission and the purpose of yesterday's heavy logistical lift, but my batteries were recharged as well, so to speak." So I'll end it there. And I'll also give a nod to Amanda. That was someone from your team. And next slide. We'll open it up for some Q&A. We really appreciate your time. And I know we have a few questions in the chat, and I don't know how we're monitoring those. So maybe we could, let's see. Maybe I'll jump into the chat here and start. I know I saw, let's see. Are the summer camps offered in multiple languages? Meredith or Carissa, did you want to speak to that at all?
Sure. I can answer from our perspective. Our camps are not offered in multiple languages. However, we do partner with the Juntos Club from Oregon State University to identify and provide a camp specifically for their students in Hood River and the Dalles. And so they've kind of become the liaison to ensure that the camp is relevant. The camp activities are relevant to not only their community, but their culture. And so we haven't taken the step to offer the camp specifically in another language, though.
And I will also say, yeah, not that the camps are bilingual, but out of our Cascades East AHEC Center in Bend, I know that they do advertise and create promotional materials in Spanish so that the students can take those home and review them with their parents. So we do try to create some of the informational materials, at least in Spanish, where those communities are. I see there's a question. Do students create a work product, or is it focused on job shadowing? Like Carissa, Meredith?
There isn't a specific work product that students are turning in, so to speak, for MedQuest camp. We used to offer a general science credit as part of the camp. But really the impact of the camp is immersing them in a great number of careers. Our camp days start early, about 8 a.m., and they don't finish until about 9 in the evening. They're really looking at the ins and outs of how healthcare works and each career opportunity in between. I might say that our camps are residential, at least 2 of them are, and so we have a captive audience all day, but they're not turning in a paper or like a community-based project deliverable or something like that.
I will say that the camp that's hosted at Pacific University through our Oregon Healthcare Workforce Institute, AHEC, they have traditionally done kind of a group project at their camp. and they have culminated with the students putting together kind of a public service announcement as kind of their week-long project. I don't know if they will continue with that programming in the same way, but historically, I know that has been a component of their camp. So it looks a little bit different at each region. A request for the transcript, so I'll leave that for you, Sarah M. And then there's a question, if I want to direct a youth from Clackamas County to an AHEC program, where's the first point of contact? That's our AHEC, our Oregon Healthcare Workforce Institute AHEC. They do serve Clackamas County. You can connect with them through that QR code that will come in the slides if you didn't get a shot of it. Also, if you want to reach out to any of us here, I'm going to put my email in the chat. I'm also happy to connect you to the AHEC director straight away. So also feel free to email me. Any other questions, comments? Do we have any former AHEC participants on this call? I'm just curious. No one's coming forward.
Hi, Millicent. This is Amanda.
Amanda.
I have kind of a question. I guess it's a question. It's going to start as a comment, and that is I really enjoyed the experience OHSU summer camps that you ran this summer, and I helped round up folks from the Knight Cancer Institute who gave a short hands-on presentation and then talked about their careers in cancer research, which is where that quote came from. And I also really appreciated Carissa describing how she recruited the EMS to the NEO-AHEC MedQuest programs, because the ask that comes to those of us who have participated and helped with NEO-AHEC is usually just like Carissa said, will you please come and bring a hands-on activity and talk about your career? And I know that I have made that ask of partners for my program too, and a lot of times the partners are very uncomfortable with that ask. I wonder if folks on your team could talk a little bit more about how you support potential partners, you know, when you give them that very nebulous ask and they go, I don't know what you need from me.
Great question.
Can I tackle that one too? I've gotten that asked too from various places, and I've spoken in front of students, and it is, for me, it is a more enjoyable and rich experience to do an activity with the students, whatever it is, as opposed to the PowerPoint presentation of where I am now and those steps along the day, or what I do, what my life as a family physician or my daily job is. And so I see those hands-on activities as really as the mechanism to which to interact with. And as more effective than PowerPoint. And so, and it's amazing too how sometimes I think something would be awkward or maybe not good enough for high school students, and has been really enriching experiences. Whether those things involve needles, like teaching someone how to suture, that is, there are a lot of people are sewing and doing needlepoint at home, and it doesn't involve any body tissue or even pig's feet. There's great models out there, and so they really enjoy it. It's also amazing to me, like, don't judge a student by its cover. It's amazing which ones do great, which ones don't, and I realize that I can't predict that. And so, like, I think that, like, suturing, for example, has been fantastic. I have a delivery model where we deliver babies. We're in rural Oregon. It's amazing how many had delivered a farm animal already. And so while, like, we talk about sex and delivery of babies in this environment, I nurse about, honestly, it's been fantastic to do that. Like, the students are much better prepared than I thought they would be. The other activities that I've seen people do that are really neat is we had our geriatrics team come in and they did like an example mini mental status or slums exam, you know, like we certainly give those to the elderly, and I'm sure there's no dementia in the room, but at least they get the idea of remembering 5 things and counting backwards from 100, and you know, those sorts of things. So you can create an interactive thing, even involving sharps or glass. And it really provides a really better mechanism, I think, than a static PowerPoint on like what our jobs are like, what our life is like.
I might add, from our team's perspective, it's really important that we have designed learning objectives as part of camp. Otherwise, these can turn into special events, if you will, as opposed to something that is working really specifically towards an outcome, which is growing our own future healthcare workforce. And so EMS and the fire department have been working with us on this camp for 35 years, thereabouts. And this was the first year that we dumped our agenda upside down. Mind you, during the pandemic, we did a virtual option. So we sort of paused MedQuest Camp and offered something virtually just to keep that going. But then when we came back, we quickly realized that we had some expansion to do in other communities, and also that we really needed to change our camp a little bit to make sure that it was relevant to students today. And so we spent a lot of time as a team, over a year, thinking about what was stale as part of our content, and what we might be able to do a little bit better. Traditionally, the fire department and EMS was on day 4 or 5 of our camp. And students, we just couldn't get them to warm up, as Carissa indicated. And so we thought really intentionally about the placement of all of the different activities that we had, and then what we wanted to get out of them. And so there's always the piece about career awareness and immersive hands-on activities. But we really made sure the fire department knew that their activities and the teamwork that's embedded within those, that had a purpose. And so we sort of just kind of co-created the experience from there. But then when we looked at the rest of our camp, it wasn't meeting our learning objectives, and we weren't being responsive to students' needs. Perhaps students were always bored with presentations, but they're not afraid to let us know now. And so really removing those presentation pieces and embedding them in an activity. And so, you know, when we go and we ask for participation, we're not just asking for them to show up. We're giving them an idea of what we want to get out of it. We're not handing them, you know, the Excel spreadsheet of objectives, but we're really pushing them towards the outcome that we want. Sometimes we hit the mark or hit the ball out of the park, or whatever analogy we want to use. But even when we don't, we learn from the students about what we missed, and work on it for next year. So I hope that answers your question a little bit. It is daunting and scary when you're asked to go and interact with a bunch of high school kids or just people in general. And so it does help if the organization that's putting forward the ask has an idea of what they're hoping to get out of it.
Looks like we got another question in the chat, which is, have you found particular community entities who are more likely to help with these activities? Do you have Meredith or Carissa, are you able to speak to that?
We're so jaded, everyone. Some organizations are a little bit easier to get students into. Private clinics, dental clinics, physical therapy, the fire department. in terms of job shadows and onboarding. Hospitals are a lot trickier. I'm trying to think. Carissa, what am I missing? I feel like we just come from such a bias place because we've cultivated these relationships over time. But there are definitely some barriers that exist with regard to onboarding requirements and the interpretation of those onboarding requirements for job shadows for youth. And that's something that we'll be working through, hopefully, as soon as I can clear my calendar to do it.
And I think to piggyback on what Meredith's saying, because our regional centers are dispersed around the state, the most likely community entities to partner kind of depends on the region, right? So like Meredith said, NEO AHEC in Northeast Oregon has been there 30 years. So they've developed particular relationships over time. But in Southwest Oregon or in, the I-5 corridor where Oregon Pacific is, their community partnerships look a little bit different, based on their hosted organization. So as Eric had mentioned when we started, 4 of our 5 regional centers are based within other institutions. So whether that be Samaritan Hospital or Pacific University, or St. Charles and Aviva, the partnerships look a little bit different, and how those organizations interact in the community looks a little bit different. Anything else out there percolating?
I have a question.
Yeah, Denise.
Hi, Melissa. Nice to see you. Thank you so much for the wonderful presentation. I was curious if you offer any sort of programming throughout the year for the MedQuest participants or just in general for middle school and high school students.
A great question. It does vary. I'll let Meredith and Carissa speak to Northeast Oregon. Again, sorry, the answer is kind of the same because we are statewide and our communities look different. Our centers look a little bit different. What that ongoing programming throughout the year looks a little bit different. I'll say Oregon Pacific AHEC in Lebanon, they have pretty robust programming throughout the year. They have a lot of partnerships with the school districts in their area, and they have quite a bit of ongoing programming. Down in Southwest, it's a little bit lighter. I'll let Carissa or Meredith jump in with what your school years might look like.
Hi, I can take this one. So our programs, we host multiple programs that repeat each year. So our rural and frontier MedQuest camps, there are week-long overnight camps. They're held in June and July. Our middle school day camp that focuses on STEM is held in the end of October. And then for MedQuest, we also have a day camp that Meredith mentioned that partners with the Juntos program at OSU. And that camp is held during the spring break, actually. We found, when we reached out to them, we found that summer did not work for their students. They weren't able to attend. But spring break does work. So we offer that. And we have also, in continuing to expand MedQuest, we have this new program, I guess. It's called the MQ, and they're single day, like a field trip type activities. Last year we had scheduled 3, but only 1 worked out for one reason or the other. But we plan to do some more. And basically we work with a specific school. So the first one we did, we reached out to Wallowa High School, and they brought, I think, 12 students that were interested in healthcare, and they spent the day with us here on the EOU campus. They do look a little bit different than the overnight and other types of camps that we hold, but it's very focused on simulation because we have some high fidelity mannequins that we're able to use. So they're able to learn how to take vitals and how to take blood sugar. and a couple other things like that. And then we have a few small presentations about like the OHSU School of Nursing has a campus here in LeGrand, so they come and talk a little bit about what the process is to get into that school and have a bit of a Q&A. We brought somebody that participated in our programs in the past back to talk to the students, and that was really sweet. She was a girl from Milton Freewater who grew up on an alfalfa farm, so I think she really resonated with the Willowa High School students. And then, of course, we don't just do the pathway programming, and so that's the other programs that we do are spread out throughout the whole year as well.
Yeah, thank you.
I do appreciate that question, Denise. We've been, this was the first year where the program office in quite some time had some programming this summer. And we brought the high school students here to the OHSU campus. And we've been thinking a lot about that. Like, okay, we had this experience. How do we kind of continue to have connections with these students or continue to support these students? And so we have been trying to at least keep them connected to other OHSU-centric resources in that regard. So things like the, opportunities with internships at Night Cancer or the Dental Explorers program, or, there's a lot of programming that happens at OHSU, and trying to be a conduit and connection, at least for the OHSU campers, to what other OHSU opportunities there might be. Since OHSU is kind of its own little world, right? So I guess we're our own community.
Yeah.
And the other thing is, I would
Thank
say
you.
some of us too are involved in or either volunteering or Oregon Pacific, AHEC, and Cascades East are part of the CTE classroom the rest of the year too. So that provides some interaction between, keeping those students interested while they're still in the classroom. I've been emailing today to set up my my suturing workshop at IW Wells. So fresh in my mind.
All right. Does anybody have any other questions for the AHEC team? Okay. This recording and the materials as well will be available on our website. The link is in the chat, and you'll be able to see everything that was presented. So thank you very much, AHEC team. That was amazing. And thanks everyone for coming. Have a great day.